Hello, my name is Dr. Nwando Olayiwola. I'm the Chief Medical Officer for Community Health Center Incorporated and a practicing family physician. I'd like to talk a little bit about the differences between the H1N1 virus and the seasonal flu virus. The H1N1 flu virus, sometimes called the swine flu, is a newer strain of influenza. It is also a respiratory infection caused by a virus, and the virus can spread from people who have it to other people through coughing and sneezing. There are differences and similarities between the H1N1 and seasonal flu. They are both flu viruses, however, they are different strains of influenza. Nonetheless, their symptoms may be manifest in similar ways, including fever, cough, body aches, runny nose, chills, headache, fatigue, and possibly diarrhea and vomiting. Both of the viruses are spread primarily through person-to-person contact through coughing or sneezing. In addition, people may also become infected when they touch something that has a flu virus on it and then touch their mouth or nose. The differences are mostly the fact that the H1N1 virus is so new that most people have never been exposed to it and therefore have no immunity. Another difference between the H1N1 virus and the seasonal flu is who was impacted. So far, the number of cases and deaths reported from H1N1 are fewer among people 64 and over than with the seasonal flu. The CDC also reports that the H1N1 virus has affected those younger than 25 years old as opposed to the older population. Because the symptoms of the seasonal flu and the H1N1 flu are very similar, it may be impossible to distinguish between the two of them on your own. So if you're experiencing flu-like symptoms and are worried that you may have the flu, please contact your healthcare provider. Your healthcare provider will be able to evaluate your symptoms and possibly test you for H1N1, as well as recommend a treatment plan. Treatment will consist of rest, hydration, medication, watching, and being very aware of when to call a healthcare professional for further evaluation and treatment. It is also critical to help prevent spreading H1N1 by washing your hands often, coughing or sneezing into your elbow or a tissue, and staying home from work or school if you have a fever or other flu-like symptoms. However, the most important thing you can do to protect you and your family from the flu is to get vaccinated for both the seasonal flu and the H1N1 flu. To find out where you can get vaccinated, contact your healthcare provider, visit www.ct.gov/CTFluWatch, or call 211. Thank you.